This is Dr. Saad in front of you, and today my topic is achalasia. So basically, what is achalasia? Achalasia is characterized by decreased relaxation of the lower esophageal sphincter. Now, why this relaxation occur? I will be explaining you this after just few minutes, and your all questions will be cleared in the end of the lecture, inshallah. So this is characterized by decreased relaxation of lower esophageal sphincter, peristalsis of esophagus. So these are the characteristics of the achalasia. Now, due to the decreased relaxation of the lower esophageal sphincter, what happens that the contractile force of the lower esophageal sphincter overcomes the relaxive force, due to which what happens that the lower esophageal sphincter remains in its contracted state. Clear? So these are the characteristics. Now, moving on towards the symptoms of the achalasia. Symptoms, the first symptom, that is the dysphagia, and it is a severe dysphagia because dysphagia of the liquids as well as the solids occur. Then we have the difficulty in belching. Simply in Urdu we say belching as a dakar, and in English if I am defining the belching, it means the expulsion of the air from the upper digestive tract, and upper digestive tract is esophagus. So this will be difficulty in belching because there is a peristalsis of esophagus, so a person cannot belch easily. There will be difficulty in the belching. And the last symptom, that is the chest pain. This may be confusing with the heart disease because patient may feel the pain in this region. So this is the chest pain. These are the symptoms of the achalasia. Now, on the basis of the cause, we have divided the achalasia into two types. Number one is the primary achalasia, and second is the secondary achalasia. Now remember one thing, whenever the word primary is present, it means that there is a defect within the esophagus or the defect is related to the esophagus. Clear? That is the primary achalasia. Now the cause of the primary achalasia, if I am telling you the cause of primary achalasia, this is due to degeneration of the inhibitory neurons. Now, I would like to explain you this term, that what this means, degeneration of the inhibitory neurons, so that your concepts may be clear. Now, listen to me. This is your esophagus, this is your stomach, and here I can make like the lower esophageal sphincter. This is lower esophageal sphincter. This is a normal diagram. Now, in the patients of the achalasia, what happens that there is the peristalsis in the distal esophagus. This is your stomach, and the lower esophageal sphincter is in the contracted state for the long time. Clear? Now, due to this contraction, the food starts to accumulate here, and the distal part of the esophagus, it becomes extended or distended. Now, why this lower esophageal sphincter is in the contracted state continuously, and why there is decreased relaxation? So, as we all know that in the GIT we have the myenteric plexus. One is the myenteric plexus and the other one is the submucosal plexus. Right now we are not concerned with the submucosal plexus because it is involved in the secretions. Here we are concerned with the myenteric plexus. Now this myenteric plexus, it is present between the circular and longitudinal muscles. Clear? Now this myenteric plexus, it is present within the circular and the longitudinal muscles, and this magnetic plexus have two types of the neurons. Clear? Now I am making you here a diagram so that it may be more clear. This is, for example, layers of the muscles, that is the circular and the longitudinal muscles. Now this magnetic plexus consists of two types of the neurons. For example, one type of the neurons are these neurons. Clear? And the other type of the neurons, they are these neurons. Clear? Now these neurons, they are, for example, this suppose that they are the inhibitory neurons, and they are inhibitory neurons. It means that they secrete nitric oxide, vasoactive peptides, and they basically causes the relaxation of lower esophageal sphincter. These are the inhibitory neurons that are present within the magnetic plexus. Now the second type of the neurons that I have drawn here, they are the excitatory neurons, and they release acetylcholine. This acetylcholine causes the contraction of lower esophageal sphincter. Clear? This is the normal condition, or normal magnetic plexus consists of the inhibitory as well as the excitatory neurons. Now in the achalasia, what happens that these inhibitory neurons are degenerated. I have written here, due to degeneration of the inhibitory neurons. So these inhibitory neurons, they are degenerated. So these when they are degenerated, obviously they will be not releasing the nitric oxide and the vasoactive peptides. When these are not released, what happens that the relaxation of the lower esophageal sphincter does not occur. It means that there will be decreased relaxation of the lower esophageal sphincter. Is that clear? I have written here decreased relaxation. Why? Because of this. Now it is cleared your question that why here decreased relaxation occur. So this is the reason. And one thing more, that why the sphincter is in the continuously contracted state, because of the excitatory neurons. These neurons, they are normal and they are normally secreting the acetylcholine, but these inhibitory neurons, they are degenerated and do not have the nitric oxide. So that is the reason the acetylcholine is continuously released and it is continuously contracting the lower esophageal sphincter here. So is that clear? This is the reason that's why the lower esophageal sphincter is in the contracted state. So that is the I want to explain you this concept. Then we have the another cause, that is due to vagus nerve degeneration. Vagus nerve degeneration. This is also related to the esophagus, because vagus nerve causes the relaxation of lower esophageal sphincter. When this is degenerated, the esophageal sphincter does not relaxes, and once again the same condition results the contracted means lower esophageal sphincter. Then we have the secondary causes. Secondary causes means that something that indirectly affect the esophagus, some other disease that is affecting to the esophagus. For example, we have one disease, that is the Chagas disease caused by the Trypanosoma cruzi. This is the protozoan that is causing this disease, and basically what is the pathogenesis of this? This Trypanosoma cruzi also it affects the myenteric plexus, or it degenerates the myenteric plexus. So this is the pathogenesis, and when the myenteric plexus is disturbed or degenerate, once again the lower esophageal sphincter decreased relaxation and the increased contraction occur. Then we have the diabetic neuropathy. We also have herpes simplex virus 1 also causes the achalasia. We have AAA syndrome, and this AAA syndrome consists of the achalasia, 1A for the achalasia, 1A for the alacremia, and 1A for the ACTH dependent adrenal insufficiency. Then we have other, that is the dorsal nuclear degeneration, which includes the polio. It also causes the secondary cause of the achalasia. Clear? These are the types, you can say primary achalasia and the secondary achalasia. Now the last thing, that is the treatment of this disease. Treatment is also easy. Number first is the laparoscopic myotomy. as its name indicates, myotomy means removal of the muscles. Myotomy means removal of the muscle removal. What happens that, for example, this is your esophagus and here is your circular muscle above the lower esophageal sphincter, and this is below. We remove these muscles, circular muscles, so that it helps in the relaxation of the lower esophageal sphincter. Then second treatment, that is the pneumatic balloon dilation, means by the help of the balloon we dilate it. Then the third and the last one, that is the butox or the botulinum toxin. Now here I would like to explain something about botulinum toxin, that how it causes the means it is the treatment, how is it is the treatment of the achalasia. Basically, just in single line I would write here, it normally inhibits the release of acetylcholine. But one thing here it is necessary to explain, that I am writing it here, that how it inhibits the release of acetylcholine. Here I am explaining you. Listen, this is your, for example, nerve terminal, clear, or you can say axon terminal, and this is your dendrite, this is your synaptic cleft. Now here is your vesicle and these are your acetylcholine. This is a protein that is called as the V snare, because it is V for the vesicle and snare protein. They are the certain proteins. Now here is a terminal T snare protein. Normally what happens that when the V snare, this is V snare and T snare, they both contact to each other, and the T snare pulls this V snare towards the terminal. So what happens that this vesicle, it is pulled towards the terminal, and here then the acetylcholine is released into the synaptic cleft. Clear? Now this is the normal mechanism, but if you are giving botulinum toxin, what happens that this botulinum toxin, it inhibits the, or it prevents the conjugation of V snare and T snare. When they both are not conjugated, what happens that the vesicle is not pulled towards the terminal. When it is not pulled, so obviously the acetylcholine will not be released. This acetylcholine won't be released, and if acetylcholine is not released, so this is the function of botulinum toxin, and in this way we treat the achalasia. So botulinum toxin, simply it inhibits the release of acetylcholine. This is enough for your knowledge, but how it inhibits the release, this is the mechanism, that how it inhibits the release of the acetylcholine. So with this we have completed our topic, that is the achalasia. Clear? The achalasia, I will tell you the characteristics, I have told you the symptoms, then we have done the types, the primary and the secondary achalasia, and then we have done the treatment of the achalasia that I have told you. So thank you so much for watching the video. Allah Hafiz.